Well, school is almost out. That means summer vacations are starting. But here's what you don't want to bring home: beaver fever or flesh-eating bacteria. Joining us to talk about some of the most common sicknesses associated with travel is Dr. Richard Chaffoo. Dr. Chaffoo, always great to have you.
Good to see you, Jen.
All right, I was looking at my notes. I've heard of some of these, kind of the more common ones, like malaria, for example. But then there's a lot that I haven't heard of. So I want you to talk about those first. The flesh-eating bacteria and spelunker's lung.
Right, so flesh-eating bacteria is actually something that I've seen as a surgeon, and oftentimes what's happened is there may be a small puncture wound or a small injury. Actually, it occurred recently in the press with a woman who was ziplining, and what can happen is bacteria can enter through that small puncture site through the skin, which is a natural barrier, and we can begin to actually develop an infection that goes far beyond the local area. So a patient may notice, a small puncture or an injury or an abrasion or a cut that just doesn't get better but gets worse, begins to swell. There's a lot of pain, there's extra fever, and that's the time when they need to get in to see their physician, because unfortunately bacterial infections that are what are called necrotizing fasciitis involve not just the skin but the underlying fatty or subcutaneous tissue and the fascia, or that covering overlying the muscle. So they can literally be life-threatening infections from what may seem to be a small site. We see this in diabetics, people that have got a little sore ulcer that occurs on the say a toe or an extremity, and they're not very well managed with their blood sugar. This can really get away from one, so you need to be very careful of an infection that doesn't clear early on. The other one you mentioned, spelunkers, that's a disease actually that occurs from people that love to go into caves, like in the Ohio and the Mississippi Valley. And what happens in those situations is these people will inhale sometimes droppings of rodents or bats, and there's a histoplasmosis, which is a fungal infection that can get into one's lungs and cause respiratory illnesses that can be very serious indeed. And so if you're in that kind of a situation, Jen, where you like to go into caves, most authorities recommend wearing some sort of a respirator, a mask, a breathing mask, and obviously avoiding rodents, especially bats, which carry other diseases besides spelunkers like rabies.
Yeah, Dr. Chaffoo, I can tell you I'm staying out of the caves, but I do sometimes like going camping or backpacking. Talk to me about beaver fever and hantavirus.
Yeah, exactly. So Jen, one of the big things that we see is infections from contaminated water. So people that like to go out camping, boating, rafting, and we'll look at these water sources and we'll say, wow, they're clean, they're pristine, let's just take some water and drink the water. Well, the problem with that is there are infectious organisms, parasites, like Giardia, and that's something called beaver fever, and ingesting that can cause the development of significant gastrointestinal symptoms. You can get nausea, vomiting, cramps, diarrhea, dehydration in extreme situations. So if you're going to be out camping, you want to boil that water before you actually use it. Use a filter, of course, and then if you're going to be around any water sources, you want to make sure that it's not near a runoff area. You want to make sure, again, you want that water to be clean and boiled.
Hey, Dr. Chaffoo, I've only got 30 seconds, so quickly, if you decide to go outside of the United States, malaria and hepatitis A are pretty popular, especially in places like Mexico, which a lot of San Diegans go there.
Exactly. And the big things, Jen, are, really investigate and look into where you're going. The CDC and the State Department have some great websites that you can look at what are endemic diseases. We notice, we always think of malaria as in Africa, but it actually exists in rainforests, like in Central America, Costa Rica. A lot of Americans go there, South America. And then, of course, hepatitis, the most common areas for that are certain provinces in Mexico, in Central and South America. So again, if you're going to go to areas where there's malaria and endemic, you want to get started on medication, anti-malarial medications, usually 4 to 6 weeks before you go. And certainly with hepatitis being what it is, there are actual vaccines for hepatitis A. The CDC says it's the most commonly preventable vaccine available disease that there is. So again, you want to get in to see your physician prior to going to these places and do your research and really figure out where you're going and what are the risks that you're putting yourself through and how you can have a great vacation and not end up in the hospital.
Yeah, exactly. And I know there are specific travel doctors actually that deal specifically with this. Dr. Chaffoo, thanks so much for being here.
Thank you, Jen.